So somebody wanted to know a little bit about the trigeminal nerve's nucleus, and it has a very long nucleus, and you can watch that video to see how big it is. But in the brainstem, with the pons being where the fifth nerve nucleus is, and then it divides into its three branches, V1, V2, V3. And so in the normal patient, the thing that you learn anatomically is that there are these divisions for the trigeminal nerve based on the peripheral trigeminal. And for the most part, that's true. And so the thing that's tricky is the nucleus of 5 actually extends rostrally and caudally. And so that rostral and caudal extends means that lesions in both the midbrain, the pons, and the medulla, as well in the upper spinal cord, all can refer pain to the eye and to the face. So you might get headache or facial pain even though your lesion is a lateral medullary infarction or a spinal cord lesion or rostrally in the midbrain. And so we cannot use this trigeminal pain to localize. It's a false localizing sign. The patient complains about the pain in their eye, but if you image just the brain, you have missed the lesion potentially because it can still be caudally in the medulla or the spinal cord. And so one of the interesting things about the somatotopic distribution of the trigeminal from the spinal nucleus is it's got this kind of onion skin configuration rather than this dermatomal distribution. So there might be involvement or sparing of just the center parts, like a target. And so the main thing that I think the question asker was asking is, where is a trigeminal lesion if the pain is being felt in the eye? And it should be V1 is the localizing nerve for that, but you should be aware that there's both a midbrain, a mesencephalic, and a spinal nucleus, and that means the face pain can be arising anywhere from the midbrain all the way to the upper cervical spinal cord and just be felt in the V1. And if you have sparing or involvement in this onion skin pattern, that's also suggestive that it is a central process and not a peripheral process.